8 hidden heart attack warning signs you can't miss. Did you know that heart attacks rarely happen without warning? In fact, your body often signals distress long before disaster strikes. Every year, millions of people unexpectedly collapse due to a heart attack, but what many don't realize is that their body had been trying to warn them weeks, even months, before. A strange feeling of fatigue, fleeting chest discomfort, or unexplained anxiety could all be subtle cries for help from your heart. The scariest part? Up to 80% of heart attacks could be prevented if we recognize these early signs and take action on time. In today's video, we'll reveal 8 critical warning signs of a heart attack that can appear up to a month before the event. These signs may seem harmless at first, but ignoring them could be a fatal mistake. Some of them might feel trivial, but they are all part of a larger, dangerous picture. Let's dive into these early warning signs. 1. Indigestion or heartburn, the silent warning you can't miss. When most people experience heartburn or indigestion, they brush it off as a minor digestive issue. They might think it's due to a big meal, spicy food, or too much coffee. But what if that burning sensation in your chest isn't coming from your stomach at all? What if it's your heart trying to send you an urgent message? Indigestion-like discomfort can sometimes be one of the early warning signs of a heart attack, especially in individuals who don't experience the classic crushing chest pain. Unfortunately, acid reflux and heart-related chest pain can feel nearly identical, both causing a burning or pressure-like sensation in the chest. They can occur after eating, but while heartburn is caused by stomach acid, heart-related discomfort happens when the blood flow to the heart is restricted, depriving it of oxygen. This makes it harder for your body to distinguish between the two. The heart and stomach share similar nerve pathways, which is why your brain might misinterpret the signals, making it feel like indigestion. This is particularly true for women, diabetics, and older adults, whose heart attack symptoms tend to be more subtle. So how do you know when to be concerned? If your heartburn is accompanied by nausea, cold sweats, dizziness, or pain radiating to your jaw, arms, or back, don't ignore it. These could be signs that your heart is struggling, and waiting too long to act could be deadly. 2. Unusual fatigue, more than just feeling tired. Imagine waking up feeling more tired than when you went to bed, even after a full night's sleep. Tasks that were once easy, like carrying groceries or even getting out of bed, feel like monumental challenges. You might chalk it up to stress, aging, or a busy life. But what if that persistent exhaustion is a sign of something more serious? Unlike normal tiredness, which typically gets better with rest, this kind of fatigue sticks around. It might last for days, or even weeks, and tends to get worse over time. You may feel completely drained even after basic activities like showering or making your bed. Many people describe it as feeling like they have the flu, but without the fever or stuffy nose. The connection between fatigue and heart health lies in the circulatory system. When your heart isn't pumping blood efficiently, blood flow to your muscles and brain decreases, causing weakness, dizziness, and mental fog. As your body compensates by redirecting blood to vital organs, your arms and legs may feel especially weak or heavy. The more severe the blood flow issues, the more fatigued you will feel, even without exerting yourself. Many heart attack survivors report feeling unusually tired for weeks before the event, but they ignored it, thinking it was nothing. Don't make the same mistake. Your body is telling you something. If you feel this type of exhaustion, don't wait until it's too late to take action. 3. Sleep disturbances. Is your heart keeping you up at night? You lie in bed exhausted but restless, unable to sleep despite a calm mind. Night after night, you toss and turn, sometimes waking up gasping for air or suddenly jerking awake for no apparent reason. It's frustrating, and you might blame it on stress, age, or a poor sleep schedule. However, what if these sleep disturbances are an early sign of heart trouble? Sleep disturbances, such as difficulty falling asleep, waking up frequently during the night, or feeling unrest despite a full night's sleep, are often linked to heart problems. While most people don't associate poor sleep with heart disease, the connection runs deep. When the heart isn't functioning properly, the body struggles to regulate blood pressure and oxygen levels, both of which are crucial for restful sleep. One major issue is called nocturnal hypoxia, where oxygen levels drop during sleep. This can occur when arteries narrow, restricting blood flow and making it harder for your heart to circulate oxygen efficiently. As a result, your brain detects the issue and triggers micro-awakenings, brief moments of wakefulness that you might not even remember, but that disrupt your sleep cycle, leaving you exhausted the next day. Additionally, the autonomic nervous system, which controls involuntary functions like heart rate and blood pressure, can become overactive when the heart is under stress, leading to spikes in adrenaline at night. This makes it harder for you to relax into deep sleep and may cause vivid nightmares, sudden awakenings, or even a racing heart before falling asleep. Sleep problems in the weeks leading up to a heart attack are common, and if you're having trouble sleeping, it's important to address it as soon as possible. 4. Mild shortness of breath, the warning you shouldn't ignore. You've walked up a flight of stairs 1,000 times before without breaking a sweat, but today, something feels different. Halfway up, you suddenly feel winded as if you just ran a marathon. You stop for a moment, trying to catch your breath, but it doesn't come as easily as it should. Maybe you think you're just out of shape or a bit tired. But what if this sudden shortness of breath is a serious sign of heart trouble? Mild shortness of breath is one of the most overlooked signs of heart problems. Many people assume breathing issues are related to lung problems like asthma or a cold, but the heart and lungs are closely linked. When your heart struggles to pump blood efficiently, your lungs have to work harder to help you breathe, which can lead to breathlessness. The key difference between normal shortness of breath and heart-related breathlessness lies in when and how it happens. If you find yourself out of breath after intense exercise, that's normal. However, if you become winded during routine activities, like climbing stairs, walking, or even talking, this could signal something more serious. In some cases, shortness of breath can occur even while resting, causing you to wake up in the middle of the night just to catch your breath. This is because fluid can accumulate in the lungs when the heart isn't pumping effectively, a condition known as pulmonary congestion. If you experience breathlessness that gradually worsens over time or occurs without physical exertion, it's a sign that something may be wrong with your heart. Many people dismiss this symptom, thinking it's due to aging or lack of fitness, but this could be a life-threatening mistake. 5. Jaw or neck pain, a hidden sign of a heart attack. Pain in the jaw, neck, or throat might not seem like a serious warning sign, especially if you're not feeling any chest pain. However, this type of discomfort can actually be a clue that your heart is in distress. Many people associate chest pain with heart attacks, but the discomfort can radiate to other areas like the jaw, neck, or even the teeth, making it easy to overlook. This happens because the heart doesn't have pain receptors like other parts of the body, such as the skin or muscles. Instead, when your heart isn't getting enough oxygen or blood, it sends signals through the vagus nerve, which travels from the brain down through the chest and into other areas of the upper body. As a result, the brain might misinterpret pain signals, leading you to feel discomfort in the jaw or neck instead of the chest. The tricky part about jaw or neck pain is that it can come and go. One day, you might feel a slight ache in your jaw, and another day, you may notice stiffness in your neck. Sometimes the discomfort disappears temporarily, only to return when you're physically active or stressed. If the pain is sudden, different from what you've experienced before, and accompanied by other symptoms like trouble breathing, dizziness, nausea, or fatigue, it's important not to ignore it. When neck or jaw pain intensifies with physical activity but eases with rest, it could be a sign of angina, another warning that your heart isn't getting enough oxygen. This should be treated seriously and investigated by a doctor. 6. Dizziness or lightheadedness. Don't overlook these episodes. There you are, going about your day, when suddenly, the world tilts, and a wave of dizziness washes over you. For a brief moment, you feel completely unsteady, almost as if you might pass out. Maybe you think it's just dehydration, or that you stood up too quickly. But what if that brief moment of dizziness is your body's way of signaling a heart problem? Dizziness or lightheadedness can be one of the first signs that your heart isn't functioning properly. This sensation occurs because your heart is not pumping blood efficiently, leading to insufficient oxygen supply to the brain. As a result, you may feel faint or lightheaded even when you haven't been doing anything physically strenuous. Some people describe it as a weak feeling, almost as if their body is giving up, while others feel an odd floating sensation. as if the ground beneath them is moving. The important thing to remember about dizziness linked to heart problems is that it doesn't always follow a predictable pattern. It can happen at any time, while sitting, standing, or even lying down. Unlike dizziness from dehydration or a sudden change in position, dizziness due to heart issues can strike out of nowhere. If you experience repeated episodes of dizziness or lightheadedness without an obvious cause, and if these episodes are paired with other symptoms like fatigue, shortness of breath, or chest discomfort, don't ignore it. Your body is trying to tell you something important. 7. Pain in the upper back or shoulders, a red flag you can't ignore. Pain in your upper back or shoulders might seem like something that can be brushed off as bad posture or a muscle strain. However, this type of discomfort can be an overlooked warning sign of an impending heart attack. Unlike sharp, stabbing pain from an injury, heart-related pain in the back or shoulders typically feels like deep, spreading pressure or tightness. This pain occurs because the nerves that transmit pain signals from the heart don't always send them directly to the chest. Instead, the discomfort can radiate to other areas, including the back, shoulders, neck, and arms. Certain individuals, such as women, diabetics, and older adults, are more likely to experience this referred pain, making it difficult to identify as a heart issue. Additionally, those with high blood pressure, high cholesterol, or a history of smoking are at an increased risk of heart-related back pain. If you notice unexplained pain in your upper back or shoulders, especially if it's accompanied by other symptoms like dizziness or chest discomfort, don't dismiss it. It's always better to consult a doctor, as early detection can save your life. 8. Intermittent chest discomfort, the silent red flag. One of the most dangerous yet frequently ignored signs of an impending heart attack is intermittent chest discomfort. This discomfort may not always feel severe, and it doesn't always last, which is why many people mistakenly brush it off. However, the truth is, this is a serious warning sign that shouldn't be ignored. The key to understanding this symptom is the word intermittent. Unlike a heart attack, which causes intense and constant pain, the discomfort caused by limited blood flow to the heart, known as angina, comes and goes. It may feel like tightness, pressure, heaviness, or even a burning sensation in the chest. Sometimes, it may not even be in the chest at all. It can radiate to the arms, shoulders, neck, jaw, or upper back. Initially, you might only notice the discomfort during physical exertion, like climbing stairs, carrying groceries, or even when stressed. The discomfort usually fades with rest, which is why many people dismiss it. But over time, as the arteries become more clogged, the discomfort can occur with less effort, and eventually, it might even happen while you're at rest. The danger of ignoring intermittent chest discomfort is that it's a direct warning that a heart attack is on the horizon. If you experience chest discomfort that becomes more frequent, lasts longer, or is accompanied by other symptoms like dizziness, nausea, cold sweats, or shortness of breath, don't wait until it becomes severe. It could be the last chance to prevent a full-blown heart attack. Preventive measures. How to take control of your heart health. A heart attack doesn't strike out of the blue. It's the culmination of years of silent damage to the heart and arteries. The good news is, you have the power to prevent it. Every choice you make today affects the health of your heart tomorrow. Here are a few lifestyle changes that can make a significant impact on your heart health. Eat a heart-healthy diet. Your diet plays a crucial role in heart health. Opt for whole foods, vegetables, lean proteins, and healthy fats like olive oil and fish. Avoid processed foods, trans fats, and excessive sugar, which can fuel heart disease and worsen existing conditions. Exercise regularly. Physical activity isn't just about staying fit, it's about survival. Regular exercise strengthens the heart muscle, improves blood flow, and reduces the risk of heart disease. Even just 30 minutes of brisk walking every day can significantly reduce your risk. Manage stress. Chronic stress is a silent killer. It can spike your blood pressure, tighten your arteries, and contribute to inflammation. Find ways to manage stress, whether through meditation, deep breathing exercises, or simply setting boundaries at work and in life. Quit smoking and limit alcohol. Smoking and excessive drinking are major contributors to heart disease. Every cigarette damages your arteries, and alcohol, when consumed in excess, accelerates the damage. Quitting smoking and keeping alcohol consumption in moderation can significantly reduce your risk of a heart attack. Monitor your health. Conditions like high blood pressure, high cholesterol, and diabetes are silent killers that can contribute to heart problems. Regular checkups are essential for detecting and managing these conditions before they become life-threatening. Keep track of your numbers and work with your doctor to stay in control. The choices you make today can protect your heart for years to come. By adopting a heart-healthy lifestyle, you can significantly reduce your risk of experiencing a heart attack. And if you recognize any of the signs listed above, don't hesitate to seek medical help. Early intervention can save your life. Conclusion: take action now, before it's too late. Your heart is one of the most vital organs in your body, and it's your responsibility to keep it in good shape. Recognizing the early signs of a heart attack can make all the difference, and knowing what to look out for is the first step in protecting yourself and your loved ones. Remember, up to 80% of heart attacks are preventable if we take action early. If you notice any of these warning signs, whether it's indigestion, unusual fatigue, sleep disturbances, or intermittent chest discomfort, don't ignore them. Your body is trying to communicate with you, and the sooner you listen, the better your chances of avoiding a heart attack. Heart disease is often preventable with the right lifestyle choices. Make small changes every day to protect your heart, whether it's eating healthier, exercising more, or managing stress. And always listen to your body. Your heart will thank you for it. If you found this information helpful, don't forget to like this video and subscribe to our channel for more health tips and life-saving advice. Drop a comment below to share your thoughts, ask questions, or tell us what topic you'd like us to cover next. Stay healthy, stay informed, and take care of your heart.